Ever experienced a terrible headache that made you sensitive to light and sound, and possibly even caused visual disturbances? You might have had a migraine. Migraines aren't just your average headaches. They are a complex neurological condition characterized by intense throbbing pain, usually on one side of the head. The pain can be so severe that it interferes with daily activities and can last from a few hours to even several days. Migraines stand out from other headaches because of their accompanying symptoms, which can include nausea, vomiting, as well as heightened sensitivity to light, sound, and even certain smells. Also, some people experience what's called an aura before a migraine attack, which is a sort of sensory warning signal that can manifest as visual disturbances or tingling sensations. Now that we've identified what a migraine is, let's delve deeper into the symptoms associated with this condition. Migraines are far more than just a bad headache. They come with a range of symptoms that can be debilitating. Imagine a throbbing pain, often on one side of the head, that can last for hours, even days. Accompanying this pain, you may experience sensitivity to light, sound, and even certain smells. It's as if your senses are on overdrive. Now, picture visual disturbances known as aura. This could be flashing lights, zigzag patterns, or blind spots in your vision. These symptoms typically precede the headache phase of a migraine, serving as a warning sign of the pain to come. But what's happening inside your head during a migraine? Well, it's a complex interplay of neurovascular changes. Essentially, there's an inflammation of nerves and blood vessels in the brain. On top of that, the neurotransmitter serotonin plays a role too, with its levels dropping during a migraine attack. Understanding these symptoms and their causes helps in diagnosing migraines. But what triggers these painful episodes? Migraines don't just happen. They are often triggered by specific factors. Stress is a primary culprit as it can stimulate the brain's pain pathways, resulting in a migraine. Certain foods, particularly those rich in tyramine such as chocolate and cheese, are also known to trigger migraines in some people. Hormonal changes, especially in women, can precipitate migraines too. For instance, many women experience migraines during their menstrual cycles when estrogen levels drop. Then there's sensory stimuli. Bright lights, loud noises, or even certain smells can cause migraines in some individuals. It's important to note that triggers can vary greatly from person to person. What may trigger a migraine in one person might not in another. Keeping a migraine diary can help identify personal triggers and patterns. In essence, understanding these triggers is a key step in managing migraines. Knowing these triggers can help prevent migraines, but how do we differentiate migraines from other types of headaches? Not all headaches are migraines. Other types of headaches exist, and they have distinct characteristics. For instance, cluster headaches present as severe, piercing pain around one eye, often accompanied by restlessness. Tension headaches, on the other hand, feel like a constant pressure around the head, especially at the temples or back of the head and neck. Migraines, unlike these other types, often come with a suite of symptoms beyond head pain. These may include sensitivity to light, sound, and even smell, visual disturbances known as auras, and a throbbing pain usually confined to one side of the head. The International Classification of Headache Disorders outlines specific criteria for diagnosing migraines. These include at least 5 attacks, headache lasting between 4 hours and 3 days, and the presence of associated symptoms such as nausea or sensitivity to light and sound. Proper diagnosis is key to effective treatment. Speaking of which, how do we manage migraines? Managing migraines involves a combination of lifestyle modifications and pharmacological interventions. Lifestyle modifications are the first line of defense. This could mean identifying and avoiding triggers, whether they are certain foods like chocolate or cheese or sensory stimuli such as bright lights and loud noises. Regular exercise, adequate sleep, and stress management techniques also play a crucial role in reducing the frequency and severity of migraines. When lifestyle changes aren't enough, pharmacological interventions come into play. Over-the-counter medications like ibuprofen can help with mild to moderate migraines. For more severe cases, doctors may prescribe triptans, which target serotonin receptors and help to reduce inflammation and constrict blood vessels. Preventive medications like beta blockers or anti-epileptic drugs may also be used in individuals who experience frequent or severe migraines. Remember, every individual is unique, and what works for one might not work for another. Migraines can be debilitating, but with the right knowledge and strategies, they can be managed effectively.